Welcome everyone, this is Dr. Piyush with my team of respiratory physicians Dr. Devan Sharma, Dr. Sarthak, Dr. Anushka and Dr. Arshia. Today we have a small conversation, actually a meeting. I would like you also to hear it and guess what type of disease we are going to talk about. So, my dear staff members, I would like to start a conversation with a myth. I've heard from many people that the disease which we are going to talk about doesn't have a cure. I know that we have very effective medications for this disease since 1950s. However, many people don't take it seriously. They don't do the full course of the medication, and as a result, they remain ill with number of complications. Isn't it, Dr. Devansh?
Yes, I agree to you, Dr. Piyush. People think that this problem is genetic. Can you believe it? Even liberate people think that it passes down to generations. But if they take proper precautionary measures, it would not pass down to their family.
Yes, Dr. Devansh and Dr. Pius. You are right that people assume that this disease is an incurable genetic illness. It is so sad that misinformation spreads faster than the disease. I have seen people who discriminate against the poor people because they assume that this infection spreads among the poor only. Dr. Devansh and I surveyed the levels of myths and rumors about the modes of transmission. It turned out that 82.6% people of India believe that this disease is only related and restricted to the poor. Yes, it is true that poor live in unhygienic conditions. It is also true that cramped and unhygienic living conditions in rural areas and marginalized localities of thickly populated cities give the airborne infectious disease many opportunity to thrive. But it is also false to claim that only poor people catch this disease. We must create fact sheets to spread awareness about this. Any person, regardless of his socioeconomic background and living conditions, can be vulnerable to this disease.
I totally agree with.
The strangest fact is that this condition can stay latent in a person. Such a person cannot pass the mycobacterium on to the other people. In addition, the person with latent infection usually has a normal chest X-ray and a negative sputum test. Dr. Arshia, your views please.
Dr. Sarthak. In my experience as a doctor, many people have a confusion that a certain type of disease is infectious or not. There are actually different kinds of this disease. Because of the variety, only one third of the patients, mostly with this disease of the lungs, are infectious. After 4 to 8 weeks of undergoing appropriate treatment, many patients became non-infectious. This reduces the risk of catching this disease to the people around the person who has this disease.
I totally agree with the other doctors. Even in my professional experience, I have seen people think that excessive smoking is the only cause for catching this disease, which is actually not the case. Smokers are predisposed to catch respiratory diseases, but this cannot be the sole reason to catch this infectious disease.